Hi, everyone. I'm Dr. Wes McCann. I'm going to be speaking a little bit today about why I decided to become an AMD Center of Excellence. Now, in terms of financial disclosures, I'm a KOL for Clarion. I also speak for Zeiss, Labtician, Johnson & Johnson, and Bausch & Lomb on occasion. So those are my financial disclosures to start. Now, if we look at AMD and we look at it relative to other diseases that we see within our practice, AMD has a much greater prevalence than glaucoma, almost 4 times, and double that of diabetic retinopathy. So it's something that we see every day in our clinic and something that's quite prevalent. And the more tools we have to manage the disease, the better off we're going to be. And evidence-based medicine is extremely important. So I'm going to put forth a lot of information today on why we've chosen to use some of these technologies within our practice to manage our patients' outcomes better. It's certainly not a young or an old disease. Its prevalence is 1 in 14 over the age of 40, 1 in 8 over the age of 60, and 1 in 3 over the age of 75. So it's certainly not a young disease, but it's something that we need to have a discussion with our patients quite early, so we get them in the mindset of how to prevent this disease over time. We screen everyone quite early within our practice. So there's lots of risk factors when it comes to AMD. There's genetics, smoking, diet, exercise, age, ethnicity. We're talking a lot more about blue and violet light these days, and low macular pigment can also be a risk factor for AMD. So these are all considerations you have to think about when you're talking to your patient. We're going to focus a little bit more on the blue light, ultraviolet light, and low macular pigment today for the first half of this talk. So the International Organization for Standardization has long recognized the danger of short wavelength light and how that can affect the eyes. And they've defined what's known as the aphakic light hazard curve function here. That's that red line. As expected, this peaks in the UV, which we're all familiar with, and we protect our patients against the dangers of UV light. But, and again, our lens really helps to block a lot of that UV within the eye. So a lot of that UV light doesn't hit the retina. But what is left is the retinal light hazard curve that you see here. And that's where the concern of the violet and blue light comes in. So there is a potential for damage to the retina there. So that is a conversation we should be considering having with our patients. So how do we prevent damage from that violet and blue light? Well, we all have macular pigments that are within the retina, lutein, zeaxanthin, and mesozeaxanthin. They really all help protect the retina against violet, blue light, and the free radicals. And macular pigment density really differs between everybody. It's something that's modifiable with lifestyle changes and with supplementation, and it is something that's measurable. So we have a device that we can measure that macular pigment density within our patients. People with low macular pigment density can, like I said, make lifestyle changes or use supplements to help prevent against AMD and build up that macular pigment density within their own retina. So within our practice, we use something called the MPI, and it is a screener for macular pigment density. It's really fast, repeatable. We have it in pre-test. It's something that takes only a few minutes to do, but it gives a value add to our patients, and they can opt into adding that to their exam. It provides a score from 1 to 10, so we can use that to counsel our patients on healthy eye habits and how they can protect their eyes and how they can have long-term strategies to reduce the risk of macular disease. So how does this MPI work? Well, the MPI creates a special light environment that causes the macular pigments in the retina to cast, or the macular pigments in the back of the eye to cast a shadow on the retina, and that patients see that as a spinning bow tie that you can see here. So that spinning bow tie is either clockwise or counterclockwise, and they direct the technician as to what they're seeing and which way it's rotating. They get a score, and it's a threshold test, much like Snellen visual acuity or visual field test for glaucoma. So we, as a clinician, realize what their threshold is, and we can coach those patients appropriately on lifestyle changes to improve their macular pigment density. So there's, like I said, lifestyle changes that they can make through diet, cessation of smoking, different things like that, or they can certainly get some early intervention by using supplementation. So Vision Essence is a great product that's available to us here in Canada. It's got the lutein, zeaxanthin, and mesozeaxanthin in it that have all shown to increase the macular pigment optical density within the retina or within the back of the eye. So it's a great tool to be able to help our patients build up that macular pigment density. So they also have other products that are available, AREDS formulations and zinc-free, low zinc options if you're doing genetic testing in your clinic. So lots of options available within their portfolio to help manage patients' macular pigment and retinal disease. So early diagnosis is extremely important with AMD. The more time we have to slow down the disease, the better. So traditionally, AMD has been classified based on the Beckman classification, and it was very dependent on structural changes and imaging. And this really means that early diagnosis wasn't made until drusen were clearly visible in the retina, and progression was based on the increasing size of that drusen. Thankfully, researchers at the University of Alabama in Birmingham identified a functional biomarker of AMD that's changing the way we really diagnose and manage the disease now. So the pivotal all-star study published in Ophthalmology shows that dark adaptation function is impaired at least 3 years before we can start to clinically see that drusen evident in patients with AMD. So think about that for a moment. If we have that much more time to slow down the disease, we can really slow down that irreversible vision loss for our patients and really prolong their good vision. So based on 30 published papers and that all-star study, a new classification of subclinical AMD based on functional impairment has been added. So by performing a simple dark adaptation test to anyone over the age of 50, especially those with multiple risk factors, and anyone with night vision complaints, we can detect and diagnose AMD much earlier, like I said, allowing us to start monitoring and treating the disease for better outcomes with our patients. So Adaptdx Pro, great test that's available now. And it's not only a functional test for measuring dark adaptation, but it's really quick and effectively used in a clinical setting. And it's mobile. So for us, we use it sometimes in the field room, sometimes we use it in one of our exam rooms. Wherever we have a free space to be able to administer the test, we can use this portable unit. It's very comfortable for the patient. It has an onboard technician called Thea. She guides you through the whole process, guides the patient, and coaches them through that entire test. So it's a great test that's used within our clinic. It spits out at the end of the exam a rod intercept score. And what that score is, it's telling us the amount of time it takes for that patient to dark adapt. If the patient's RI score is below 6.5, then the patient has normal dark adaptation function. If it's over 6.5 minutes, then the patient has impaired dark adaptation. So we do repeat the test with an extended test at that point. If they fail again, then we counsel them on lifestyle changes and vitamin supplementation to try to maintain the health of that retina as long as possible. We start monitoring them annually, and then once we see drusen accumulating, then we'll switch that patient into OCT testing. So you may be asking, how accurate is the Adaptdx Pro? Valid question. And again, we want to be practicing evidence-based medicine. Well, this is a validated multi-site study that was done. And what happened was it noticed that there was a high sensitivity, over 90% confirmed AMD cases, and a high specificity where it correctly identified over 90% of confirmed normal cases. So really high accuracy overall, 90.6%. How good is good? Well, how good is 90.6%? Well, if you look at over 200 published papers on visual field machine, it is only 83% accurate for detecting glaucoma. So quite happy with the level of accuracy in this test. Even studies show that retinal specialists have been shown to only be 80% accurate in detecting AMD on a routine fundus examination. So I would argue that this test is a very good, sensitive and specific test, highly accurate for patients. So what's our AMD protocol? Well, we want to test patients early. So anybody over the age of 20, we recommend and counsel them on the advantages of macular pigment testing. We have our supplements available for patients that have low macular pigment density or those that are failing the dark adaptation test once they're over the age of 50. We can counsel them on the advantages of blue blocking lenses within our practice. Opens the conversation with sunglasses again even more. So our protocol is over 20, we start macular pigment density testing. Over 50, we start the dark adaptation testing for early signs of AMD, especially if there's additional risk factors like family history and low macular pigment density scores. So what's the ROI? Well, there's definitely increased options or opportunity for value with the additional testing with both the Adaptdx and the MPI. You've got your consumables with your Vision Essence And again, you becoming a site of excellence for macular degeneration definitely has its ROIs. So, and again, increasing your dispensing in the optical of blue blocking and UV protective sunglasses. So reach out to your rep for more information on these technologies. They've been a great value add to our clinic. I can't say enough about them. And I think they're a great opportunity for optometry to really own AMD and become the center of excellence to be able to manage our patients appropriately in a disease that's quite prevalent in the population compared to other ocular diseases that we see on a regular basis. And it really puts peace of mind at a lot of your patients because they are quite concerned about this being something that will affect them in lifetime. So good luck, and reach out to Clarion if you have any more questions.